All right, being that it is 4 o'clock, I hereby call the Health and Human Services Committee to order. And the item number 2 is public comment period. Nobody has registered in advance, but if anybody from the public would like to take a brief moment to speak, I would allow that. Is there anybody that would like a moment to speak? Okay, seeing none, we'll move on then. Item 3 is the approval of the August 4th, 2021 Health and Human Services Committee meeting minutes. Those were sent out in advance. Are there any additions or corrections to the meeting minutes? The only thing I would mention is under the next scheduled meeting, we had down September 1st, and we did discuss at that meeting to move it to today, September 8th. So maybe we should acknowledge that, we did move it. Any other additions or corrections? Then a motion to approve would be in order.
Supervisor Harris, I'll make a motion to approve with that one change.
Okay, thank you. Is there a second?
I'll second Supervisor Van Cray.
All right, thank you. Motion is second. Any further discussion? Seeing none, all in favor say aye. Aye.
Aye.
Aye.
Opposed? Motion is carried. Thank you. Item 4, policy issues, discussion, and possible committee determination. We don't have anything under that heading today, so we'll move on to item 5. Operational functions required by statute, ordinance, or resolution. 5A is acceptance of 2021 grant funds in connection with health department activities related to COVID-19 public health workforce grant of $180,300, and also COVID-19 immunization and vaccine grant $195,000. ARPA, Wisconsin and DHS COVID-19 grant response grant of $1,037,700. And that information is in your packet. We do have with us today our new Health Department person, Laura Scudieri, to give a little bit of color to this subject. And Laura, I invite you to speak to the issues.
Up a little bit. Just if I may, Mr. Chair, before Laura comes up here, I'd like to set the stage as to why, in terms of process, you're hearing about grant funds, which certainly sounds like, hey, these are a great deal, and they are. But the reason you're hearing about them is we do have a grant review policy within Marathon County Administration as it relates to the health department grants, because health department grants frequently come in during a calendar budget year for the county that don't necessarily align up because of the state's fiscal year and the federal fiscal year. They need to come in as budget amendments. So our grant review policy requires that the potential grant of funds in the course of a budget year have approval from both the standing committee for the health department, which is this committee, as well as the HR, Finance, and Property Committee. Ultimately, those do come in. They are received as revenues within a budget year, so they require budget amendments. So with that little bit of background, Laura is going to give you a presentation relative to each of the grant opportunities that are listed in your packet, and also kind of lay the foundation for why the acceptance of these grant dollars is not only a good thing from a revenue perspective, but it's also necessary in light of the work of the health department and the state of the pandemic. So with that, Laura, come on up, and I do have your PowerPoint that I will share on this computer so that you can not only
advance it.
You can drive.
Oh, great. Okay. I think I'm good to go. All right. Thank you, everybody. Appreciate you the opportunity to speak to you today about these grant opportunities, and also to give you an update on where we're at with COVID and kind of the state of the health department as it is today. Please feel free to interrupt me with questions. I'd be happy to answer any questions that you may have. All right, so where we're at. On June 16th, DHS did a press release identifying the SARS-CoV-2 variant called the Delta variant as a variant of concern. And what that means, we have 3 levels that we use in public health world. The 3 levels are, they go from a variant of interest to a variant of concern to a variant of high consequence. Basically what that means is that the levels go up if we're not able to prevent it effectively, if it is more transmissible, or if our diagnostic ability is not as good. So right now, Delta is a variant of concern. As of yesterday afternoon, there were no variants of high consequence that have been identified for COVID-19. So I want to give you a brief understanding of why we're concerned about Delta. Delta spreads more easily than all the previous variants. In fact, it can cause as many as 2 times as many infections as the regular SARS-CoV-2. This is a CDC graphic. I like this graphic because it really demonstrates very clearly that it's more infectious. The Delta variant also may cause more severe illness than previous variants in unvaccinated individuals. Those who are unvaccinated remain of greatest concern. Those who are fully vaccinated can still get the Delta variant. We know those as breakthrough infections. But vaccinated people spread the virus for shorter time periods and are less likely to have severe symptoms or require hospitalizations. So I want to walk you through a few pieces of data. So this first graph is from the Wisconsin Department of Health Services. This is the cumulative total of deaths, COVID deaths that were confirmed and probable as of yesterday. So as you can see, Marathon County has 239 deaths. More notifications are coming in daily. We had a brief period when incidents of COVID deaths decreased in June, but now we are seeing death counts rise again. The largest number of deaths previously for Marathon County were in November and December of last year. So, we are concerned about deaths, but we're also concerned about other post-COVID conditions. We want to prevent deaths. We also want to prevent COVID long haul. So CDC is currently looking at long-term effects of COVID. Some of the effects can include cough, chest or stomach pains, headaches, joint or muscle pains, diarrhea, sleep problems, fever, rash, mood changes, fatigue, difficulty breathing, difficulty thinking or concentrating, sometimes referred to as brain fog, just to name a few. And those can be long-term past the initial infection. Also, in some cases, there's, especially in kids, there's multi-inflammatory syndrome. It's very rare, but it is a concern. So this gives another understanding of Marathon County. This is a graphic that we have on our website every day. It gives you the indication, a separation of fully vaccinated versus not fully vaccinated, who's becoming hospitalized. And you can see that there's a disproportionate amount of hospitalizations in the not fully vaccinated column. So we have been very focused at the health department on vaccination. It is a safe and effective way to mitigate the spread of COVID-19. Any questions so far? This is another infographic that we put on our Facebook page every day. We also update it on our website. It gives you the sense of how many new reported cases are happening each day, the cumulative cases, the new deaths and cumulative deaths, and the reported hospitalizations. So I just wanted to call your attention to it because we do post this every single day to give you a sense of where we are at in the county. Internally to the health department, we are tracking 7-day average of cases. This is, the blue line is Marathon County. You can see that it's on a steady trajectory up. The last 2 weeks, we've been averaging about 39 cases a day. And this gives you a quick look at the number of cases in relationship to some of our other counties as well. This is the number of reported and confirmed probable. The gray box on the far right are just preliminary data. So we expect that there's more data that will be added to that. But you can see the red line is going back up. And what that indicates is that case counts are mirroring this time last year. And that was when cases were rising and we didn't yet have the vaccine. Just to give you a sense of what that does at the health department, we are currently over staff capacity to effectively do evidence-based contact tracing. We have started crisis standards of care, which includes having positive cases call close contacts and prioritizing populations that are disproportionately impacted due to the fact that they do not have approved vaccination options. So an example of that population would be kids that are under 12 years old. Each positive case can have anywhere from 5 to 100 contacts, on average having about 30 to 40 per person. This is further complicated when kids are exposed in schools, as some schools have been actively participating and assisting with us with identifying, It's complicated when kids are exposed in schools. Some schools have been actively participating and assisting us with identifying new contacts, and others have not chosen to do so. In order to keep up with demands of disease investigation and contact tracing, we need to effectively double our current contact tracing staff just to keep up with our current numbers. And that doesn't take into consideration that with any additional cases, we would need additional staff and additional infrastructure to support that staff. So this is the DHS graph. You can see it's very similar to the graph before. This is Marathon County data. We are seeing case rates, again, similar to this time last year. If we use last year as a reference, you can see how quickly this can escalate, especially with schools reopening. And some of the schools have little to no COVID mitigation strategies in place. We are asking the community to vaccinate and seek vaccination for kids who are over age 12. We can help anybody find a vaccination. A great way to find vaccination is going to vaccines.gov. And right now, if you get vaccinated, you can get $100 from the state. So that's pretty cool opportunity. Vaccination, I should mention vaccination, individuals that are vaccinated do not have to quarantine if they've been exposed. That's especially important for kids over age 12, because if they're in school systems and they get exposed, they do not have to quarantine if they've been vaccinated. We currently, to date, we have 37 students that we are, and staff that we are tracking in Marathon County that are positive. All right. So this is our hospitalizations. I want to talk about hospitalizations real quick. Due to COVID in our area, our hospitalizations continue to rise. I've been in contact with the Spirus Hospital, and they are at capacity, only admitting patients into the PICU or the birthing units currently. This was also reported in the Wausau Daily Herald today. One hospital recently submitted for ventilators out of the federal stockpile. There are some differences between the hospitalizations we're seeing this year versus the hospitalizations we saw last year. For one, the population that require hospitalization has been younger. The second is that our ventilator usage has been increased. Last year, our hospitalization in this region really peaked around November 18th to 19th. We're not just monitoring the season for Delta, we're also seeing an increase in other respiratory illnesses, particularly RSV. This increases the number of individuals who may need hospitalization. And we care about hospitalizations because we worry about beds being full for all patients, not just COVID. So if a community member would have a stroke or a heart attack, they may have to be transported far away or outside the area in order to be admitted to the hospital for care. So that is a concern that we continue to monitor. So what you have in your packet today are 3 proposals for to accept grants. We are approaching our 19th month of COVID response. There has been continual impact on all programs and services, and without additional funding to support additional infrastructure, we will continue to have further erosion of our required services as listed in the Administrative Code 140. The state has not announced or provided additional information on the stipulations or conditions around the use of these funds yet. The preliminary communication has focused that this would help us provide staffing structure to mitigate ongoing spread of COVID-19 and related prevention functions. It would also provide us with necessary infrastructure to support ongoing pre-pandemic priorities and other required services, and those services are the things that are in Administrative Code 140, like inspections, immunizations, other communicable disease support, substance use, and mental health coalition building, and other things that are in Marathon County's Community Health Improvement Plan that were determined as priorities for our county. So with that, I will conclude my comments. Does anybody have any questions or thoughts?
Go.
Oh, sorry.
I had one question, Laura. The death count. There was 202 on your one slide. That was cumulative since yesterday. Earlier, it was 239. Is that because that 239 figure includes some that were suspected?
There were probable cases in that one.
Okay.
So the one that's on the screen right now is confirmed and probable.
Okay. All right. Very good. Thank you. Supervisor Krause.
Thank you, Chair Butke. What I was wondering about was, you have people who may just have a bad day or ate something and it disagreed with them, or they became allergic to something. How do you determine if they have COVID or not? Is it a blood test, a nose swab? Could you explain that?
We do, so generally, there's a couple different kinds of tests. There's what we call the PCR, which is the gold standard of testing. And generally, it could be done in a nose swab, a nasal swab, or it could be done in a swab that people say it feels like swabbing your brain. It goes up into the sinus cavity. More likely, it's just a nasal swab. And what they're looking for is antibodies and antigens, so, depending on what kind of test you get.
Thank you. And I have another question.
Yes.
I had read about the too late to take advantage of it, but there was that $100 amount that Governor Evers had declared for those who wanted to get COVID shots, because there haven't been that many people who have gotten their shots. But what I read was that it had ended a few days ago. No?
No, it's been renewed, so thank you for bringing this
renewed.
up. It's until, I believe, September 16th is the last day now, so.
Thank you.
Yeah.
Okay. Other questions from committee members? All right. Very good. Thank you, Laura. I think now we need to move on to discuss the grant review for the three different grants that are on the table for us today. Are there any questions or comments on those grant funds? Because I think, if I understand correctly, purpose of our committee then today to review these, basically, if we in fact approve them, they would move on to finance. And then if they get approved there, then we go ahead and do this. So I don't think there's a downside to this, although I think you indicated, Laura, that stipulations or whatever, that has not been forthcoming as of yet. So that's probably the only thing that, some cautionary there. But any other thoughts from committee members? Otherwise, a motion to approve accepting the three grant funds would be in order.
I make a motion to approve.
Okay, Supervisor Krause made a motion to approve the three grant funds. Is there a second?
I'll
I'll make a
second.
second.
Okay, we have a second from Supervisor Van Cray. Any further discussion? Seeing none, all in favor say aye.
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 Opposed? Motion carried. Thank you. Very good. All right. On then to item 5B, which is the cooperation agreement for the CDBG program. I think Supervisor Harris, you're kind of the one that had championed this a little bit. If you want to give us a little background on this subject.
Sure. So the CDBG program cooperation agreement. So Juneau County is the one that essentially heads the program. So we have meetings every so often. But how the program works is that, we basically provide information out there, but any one of our residents from the county can apply for this particular grant. And the grant money can go toward, let's say, repairs to the home or other assistance related to housing or those types of things. So that program, in order to continue with that program, we have to sign a cooperation agreement. That we're in this bubble with the other counties in terms of being able to have our residents access those funds. So this is really just a renewal agreement of that cooperation agreement.
Okay. Very good. Are there any questions or comments from committee members on this subject?
This is Supervisor Van Cray. I have a question. I don't know if Supervisor Harris can answer it. But I was just wondering how this specific grant program is advertised to people.
Sure. It is, so I know there's pamphlets and other things down at the courthouse. I had sent Chairman Gibbs early on. We had sent out, I believe, a press release. So it's been marketed out in different ways. And then I think Juneau and some of the other counties also sends it out to their websites. So that's how it's been marketed, really, in terms of pamphlets, press release, and through the counties.
Okay, thank you.
Okay. Any other questions for Supervisor Harris? Supervisor Krause, go ahead.
Thank you. Are there any particular kinds of qualifications for people accessing these grants?
There are, and they are on the website, and I can get, for next meeting, I can have that website information and go back over that next meeting in detail in terms of that particular grant program. Apologize, I did not have that this meeting, because this one is, the approval for this one is really just so that we continue to be able to access those funds as part of the cooperation agreement. But I can certainly bring that information for the next meeting in terms of more details in terms of access to that information.
Thank you.
Okay. Yeah, the action point here for this is now therefore pursuant to Wisconsin statutes, Marathon County and Central Wisconsin Housing Region agree to cooperate in the submission of an application for such funds and agree to cooperate in the implementation of the submitted CDBG program. This has no fiscal impact at this point, but this would go, if approved, goes from this committee then to the full board? Yeah.
And Mr. Chair, just for everyone's edification, if you do wish to look at the website referenced by Supervisor Harris, I did put that in the chat. If you search for Juneau County, Wisconsin CDBG Program, it takes you to a website that lists the various activities that are funded, or eligible for funding, I should say, under the program, ineligible activities, as well as it clarifies who's an appropriate applicant for the dollars that Supervisor Harris referenced.
Any other questions or comments? Otherwise, I would accept the motion to approve.
Supervisor Harris, I'll make the first motion to approve.
Okay, Supervisor Harris, is there a second? Okay, a second from Supervisor Krause. Any further discussion? Seeing none, all in favor, say aye.
Aye.
Opposed? Motion is carried, and this will move on then to the full board for consideration and hopefully approval. Thank you. All right, item 5C is the resolution declaring October Domestic Violence Awareness Month, and that is also included in your packet. We do have a couple of individuals with us today, I believe from the women's community, right? Unfortunately, LaTanya Campbell had to leave, but we do have the resolution in hand. If you would, one or both of you would like to come up to a microphone and just say a few words, kind of fill us in on the situation, I would appreciate that. Thank you. I have to press the
You
button.
want to come right up here? And
Yeah, come on up.
There you go. That way they'll get you on video.
Great. So my name is Ashley Bors, and I am the Justice Systems Program Coordinator at the Women's Community. Domestic Violence Awareness Month in October is a time for us to speak up against domestic violence, raise awareness, and support survivors of this common but devastating issue. Just to look at some statistics, nationally, 1 in every 3 women is a victim of intimate partner violence, and 1 in every 9 men experience intimate partner violence. Statewide, and this is included in the resolution, in 2019 in Wisconsin, one person every 5 days died from domestic violence-related homicide. Locally, according to the Department of Justice statistics, in 2018, there were 679 incidents of domestic abuse just in Marathon County, and 33 children were involved in those cases. We also, on a local level, saw 3 domestic violence-related homicides just this year alone. Our county also implements the Lethality Assessment Program, which is an evidence-based danger assessment tool that law enforcement uses at the scene of a domestic violence report or arrest. This program is now a year old in October, and our preliminary data from that, of every screen that was issued by Wausau Police Department and Everest Metro Police Department, 60% of the screens administered resulted in a high danger result, which means that 60% of people in Marathon County who are experiencing domestic violence are at high risk for being killed by their partner. Of the victims that were screened high danger, 71% of them agreed to speak to a hotline advocate, which is huge for our agency and allows us to provide immediate protective services to those victims. We also recently added the Sheriff's Department onto the Lethality Assessment Program, making this now truly a county-wide response to domestic violence. The proclamation brings awareness to domestic violence in our community and our collaborative efforts to hopefully eliminate it, and also shows solidarity and support to survivors who are living with the lasting effects of domestic violence, and to those who are still considering it, what it would mean to ask for help. Does anyone have any questions for me that I can try to answer?
Supervisor Krause.
Thank you, Chair Butke. What I was wondering about was who has written this resolution? And then secondly, usually at the bottom of resolutions, we have lines where each committee member signs onto this before it goes to the full board. So I'm wondering if you could answer those 2 questions?
I can try. So I did write the resolution, and I paired it from a lot of different resolutions that we've seen and done over the years, and also some of the governor's resolutions that I've also seen. It was also my first time writing a resolution, so I apologize that there was not a section at the bottom for signatures.
Well, actually, there is.
Oh,
I'm
great.
not sure what you're looking at, but
Oh, I didn't see that on my.
Wonderful.
it also shows there is no fiscal
PDF.
impact, which is important.
Okay.
But the only thing I thought of while looking at it was, we do like to tie resolutions into somewhat of our vision. It's on the wall over here and the 2 that this definitely lays into is the healthiest and safest county in Wisconsin. And clearly this resolution and the whole purpose of the awareness of this would fit into that very nicely.
Yes.
But yeah, so
Yes.
I have some more questions.
go ahead.
You said that in cases where there's critical, it's a critical situation.
Yes.
And there's many or some processes that you go through for protective services. What are
Yes.
some of those?
So are you talking specifically about the high danger lethality screens?
Yes.
Okay. So part of that purpose of that screen is to immediately connect victims to supportive services. So while the officer is on scene with a victim, if that victim, by answer of 11 questions, is screened at high risk, they are immediately connected to an advocate while on scene. That advocate will then go through a brief but thorough immediate safety planning and access to services while they're encouraging them to come in for services. So part of this program's research found that, so it studied homicides in Maryland over a course of time. And it found that 28 to 33% of homicide victims during that time, the homicide was the first act of violence. It also found that in that time, 44% of abusers had been arrested and 1/3 of the victims had called police. But only 4% of the victims in the year preceding their death had access to domestic violence services. So what that says to us is that the victims who are in most critical need of protective help are not self-initiating to services. They're not coming in on their own. So this program capitalizes on the fact that law enforcement does have more frequent contact with those victims and uses that to get them in contact to immediate protective services. So when we encourage them to come in for services, we can offer shelter. We can offer some housing and immediate needs through our pantry. We can also offer some assistance through the legal system, supporting people through the criminal justice system, restraining orders, help in family court. So there are a lot of differentiated services that we can offer specifically to victims who are at highest risk of being killed by their partner.
Thank you. Some more questions? I know that there's been increased services through the women's community for women in the community. I was wondering if it has expanded to where some women who have had their door locks broken, windows broken, forced entry, things like that are available, that there's someone who is available to install deadbolts or security systems
Sure.
in their homes.
So that is something that we do work on with victims, especially when they are working through the criminal justice system. If we have found that through that case that they've had their door locks broken down, or they come in and tell us that has happened, we do have resources. We provide locks at our building, and then we can collaborate with a local locksmith to have those locks changed.
Thank you.
Any other questions for Ashley from supervisors that are on the line? All right, I guess not. Ashley,
Thank you.
that was very well done. Appreciate
Thank you
you've
very
got a
much.
good grasp of statistics at the tip
Thank
of your
you.
That's impressive. I like that. So, okay, so we have a resolution to consider. Are there any thoughts or questions or concerns from supervisors regarding the resolution?
This is Supervisor Van Cray. Were you looking for an amendment possibly to add in something about being the healthiest and safest county? Is that what you were
Well,
thinking?
yeah, that's just my thought. That'd be good to have it in there. As it is, it's fine, but it would tie in probably a little nicer with our whole purpose, our vision and our mission and so forth. So I'm just thinking about where that would be. Probably toward the end.
Yeah, I don't know if it would be appropriate to have it as its own whereas right before the now therefore or not. I've not.
Yeah. And whereas Marathon County, whereas Marathon County's vision is to be the healthiest and safest county in Wisconsin? Just something as
that's what I-
simple as that.
Yes.
Now, yeah. Okay.
So do you need a motion? Should I make a motion?
Why don't you go ahead and do that? We'll see how it goes.
I'll make a motion to amend the resolution to include an additional whereas regarding Marathon County striving to be the healthiest and safest county in Wisconsin right before the now therefore.
Okay.
Supervisor Harris, I'll second that.
Okay, we have a motion and a second to propose an amendment to the resolution to include a whereas Marathon County strives to be the healthiest and safest county in Wisconsin. Any further discussion on that? First off, let me just think about this for a second, because we should have a resolution or a motion to accept the resolution. I kind of botched this up, didn't I?
Yeah, I got too excited.
So I'll accept a motion to approve the resolution first off.
I make a motion to accept the resolution.
Okay, we have a motion to accept the resolution. Is there a second?
Supervisor Gonring, I second the motion.
Very good. We have a motion and a second to approve the resolution. Now I would accept Supervisor Van Cray's amendment to the resolution to include that whereas that we discussed. And we already have a second on that as well, okay? So all in favor of the amendment signify by saying aye.
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 Opposed? Motion carried. So that is now included in the amendment. So the resolution as proposed with the amendment is now up for discussion. We already have a motion on the table to approve. Is there further discussion on the amended resolution? Seeing none, I will call the question. All in favor of the resolution declaring October Domestic Violence Awareness Month signify by saying aye.
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 Opposed? Motion is carried, and that'll be on the agenda for the September board meeting. So,
Chair, but I do have one question. Latanya had asked me if the resolution will be read at the full board meeting, and I couldn't remember, in a case like this, will the clerk read the full resolution, or will just be included in the packet?
I believe at the educational one, it gets read, right? Or,
It'll certainly be in the packet, I can't recall.
yeah, it may not be. So, go, Supervisor Krause.
I think it's somebody from the board who requests that the clerk read the
We-
resolution. That's what's been done before.
And we can do that.
Or
Yeah.
chair.
Either I could
gets
ask for it, or Supervisor Van Cray, if you'd like to, we can ask for it to be read.
Okay.
I think it is worth the time and effort to do that. It's an important enough problem. So,
And that would be at the educational meeting, correct?
yes.
Okay.
Okay. Okay. On to item 6 then, educational presentations and committee discussion. We don't have any today for that. So on to item 7, which is the next meeting time, location, announcements, and agenda items. 7A is committee members are asked to bring ideas for future discussion. I did talk with Vice Chair McEwen earlier today, and he does want to be on the agenda next time to discuss how our committee is fitting in with the strategic plan priorities, specifically items 3.3 and 3.7 and 7.2, which our committee does take the lead on. That ensures that every child makes it to adulthood with health, stability, and growth opportunities. Item 3.7 is to ensure that every person has local access to effective mental health treatment. And under 7.2, that's to mitigate the impacts of heroin and methamphetamine epidemics in Marathon County through evidence-based practices. So we will be discussing that at our next meeting. So, and we will discuss how we've hopefully tried to address those over the last year.
Mr. Chair?
Yes, go ahead.
Yeah, thank you. Thank you for reminding the committee about the strategic plan. I just want to mention that 2022 is the last year of our 5-year strategic plan. And so I just wanted to ensure that, or make sure that the committees are, keeping their eye on those objectives and the outcome measures, which there are 3 of them on the bottom of each one of the objectives. So that would be something that if they could review before the next meeting, that would be great. So thank you.
All right, thank you. Any other issues under item 7A? Supervisor Krause, go ahead. Oh, there you
Is
go.
that announcements?
We're not up to announcements yet. Well, actually, go ahead if you.
Okay.
Yeah.
I'd like to say that October is also Chronic Pain Month, and that happens to be one of the highest medical costs in the United States. And of course, that's also related to the opioid epidemic and the illegal drugs epidemic, where people are medicating themselves with illegal substances. There is acute pain, which usually doesn't last more than 3 weeks, but after 3 months, if pain continues, it's considered chronic pain. And so I just wanted to mention that October is also Chronic Pain Month. Thank you.
Good. Thank you. Okay, any other comments from committee members? Then I would like to say our next scheduled meeting is October 6, 2021 at 4 o'clock. Then I would accept a motion for item 8. Anybody wish to adjourn?
So moved.
Okay. Do we have a
Second.
We have a motion and a second. That was Supervisor Van Cray and Harris. All in favor say aye.
Aye.
Aye. Opposed?
Aye.
Motion is carried. Thank you for your time today.
This is great. Could I give you a call?
Supervisor McEwen, who are you speaking to?
I was just requesting if Tim could give me a call.